special episode today of the Just Start the Conversation podcast. It's brought to you by St. Luke's Penn Foundation. You can visit pennfoundation.org for more information. As always, I'm joined by our host, Amie Allanson-Dundon. Amie, how are you today? How are things? Are you wonderful?
Good to see you. I am fine. I am good. I'm loving fall. It's my favorite season. So all things football, and I'm not a pumpkin girly, but everything else, fall, bring it on. S'mores, campfires, football.
Okay. Go Birds, no
Go
pumpkins.
Birds.
We got it.
Right.
I mentioned that this episode is a special one today because I think anytime that you can connect with kids that are making an impact in a special way in their community, that's a really amazing thing. And we've got two girls who are doing just that. And I'm going to introduce you to them, and then I'm going to let them tell you about Are You Okay? Adelina Catrona and Sammy Stankus are here joining us today. Two high school students who felt like there was an impact that could be made right there in their high school. And so, girls, I want to say thank you for joining us today to have a serious conversation about mental health, and just welcome you both to the Just Start the Conversation podcast. And can you tell us a little bit about Are You Okay?
So we started the club called Are You Okay? Kind of just to raise mental health awareness. And this whole thing kind of started with like the core like 6 of us all kind of came together, and we all each brought our own concerns in. And we realized that the main point was the mental health awareness at our school and many schools around us. So we wanted to make a club and kind of for that purpose to raise awareness of all the issues that we were seeing at our school.
Yeah, and we saw through different perspectives for the organization side that there wasn't enough talk about it, and students did not know where to find resources to get help. And also sometimes kids don't have parents or teachers to talk to, so we wanted to create a space where it's a community and they feel safe, where they can talk about any problem that they're dealing with.
Amie, I want to come to you on, listen, we're hosting a mental health podcast here, right? So it's what we're going to talk about. But two students, seniors in high school, coming together with a group of other students to talk about mental health, to put it on the map. Can you just go into a little bit about how special that kind of thing is?
Yeah, this is really what every community needs. Is the involvement of all generations and kind of the coming together of our kids. And these young women are special. And, hats off to Souderton area high school for supporting this effort. There are clubs in high schools and schools around the country for mental health, but this Are You Okay club really warms my heart. And, this instills some hope. Right, in the fact that as a community we can come together and support our kiddos and these folks who are going to be who are young adults and who are going to be working in our communities and going to college and doing amazing things and figuring out that, listen, it only takes 4 letters, to save a life. This Are You Okay club that they're starting at Souderton, and special isn't the word to describe it, right? The administration at Souderton and the students at Souderton are super special, and I think are certainly role models for other high schools around the country.
I think that's amazing, that Are You Okay text message. It's that simple to kind of get connected with somebody there. So, girls, I want to come back to you here because I think when most people think of a club in high school, they think it probably stays within that high school's walls. The two of you have been all over Pennsylvania so far, trying to take this thing to the streets and make it bigger a little bit. So can you tell us a little bit of your experiences so far with Are You Okay and how you've been able to expand it beyond your high school experience?
Yeah, so recently, last year, we kind of paired up with the MCIU, and we were able to go to the capital of Pennsylvania in Harrisburg and present to numerous congressmen, women, and senators and representatives, just kind of like the foundations of our club, and kind of just asking for more help on their side, saying like, hey, what are you doing to help fund these mental health programs that we're trying to start? Because we were mainly looking for funding that was longevity and not only through grants that would only last a short amount of time, because we're we can't make really something if we're not going to know where our next check is coming from.
Yeah, and we also talked to other schools that were there pitching their ideas, And someone from North Penn said they wanted to work with us to create an Are You OK club at their school. And then we also met with Congresswoman Dean, Madeline Dean, who there was someone there from Norristown, and he said he wanted to work with us too. So we have a couple partnerships that are starting.
I want to talk a little bit about the role that the administration there at Souderton played for you girls, because listen, there's a huge ecosystem in a high school, right? There's sports, there's music, there's theater, there's all of these different kind of clubs and groups and things that are going on. Matt Haynes, your assistant principal there. I know Miss Harper helped set some of this up today for us to get connected with you. The role that the administration played in helping you both kind of get this thing off the ground. Can you talk to that a little bit?
Yeah, so we're really appreciative of our staff here, and Mr. Haynes, he was a big help. He actually helped put together our group. I know that my peers of part of the Six, like I barely even knew them or were friends with them, and he really helped us form like a nice like close-knit group. And we would meet kind of during the school days whenever like we could find a free time to really sit down, talk, and get together and really form like a concrete plan of how we would present to these like representatives about our cause and like the best way to spread awareness.
Yeah, and also he helped us find advisors for our club too. So our teachers, we have Mrs. DeFranco, which is one of our advisors, and then Mrs. Harper too. So he helped collect those advisors for us so we could start the club. So he went on the teacher side of it too.
Mm-hmm.
It's amazing. Amie, I'm coming back to you here. Mental health at this age is there's a lot going on as you're kind of going from being a kid to a teenager to being adults. The mental health aspect in all of this, can you just touch on a little bit? You talk to people of all ages, the mental health load that could be there for somebody at the age of high school, and just when is a good time to talk to somebody? This Are You OK program is an amazing start for helping kiddos kind of find a way to breach a conversation with somebody. If it just starts with a text message, for somebody that's feeling a certain kind of way, to start to talk to somebody who can maybe help them. And then for people like yourself who talk to people professionally, just the state of the mental health of a teenager now, and kind of the role that you play in helping there, but also just the general assessment of kind of the mental health of teenagers now.
Yeah, I think we've seen a shift over the last 5 years. We've talked about the pandemic on this podcast many times, and the shift during the pandemic towards isolation and depression and learning developmental delays. But what we know is that CDC reports, they lag. So if we're looking at data from 2022, suicide was the second leading cause of death for individuals aged 10 to 14 and the third for those aged 15 to 19. And, while we're starting to see those numbers come down a little bit, which is amazing, we have a lot of work to do. So, what's happening? I think one of the factors that we see is the stress load on kids is different. I'm not going to say worse. It's just much different than those of us who are, parents and grandparents ever faced. So social media pressures are different. Political, environmental, socioeconomic pressures and stress are different because of the exposure to the news media and social media. Social media is fantastic. There's a lot of really good about it, but we're flooded with a whole lot more traumatic information in a very quick amount of time than we ever used to be. So that plays a factor, right? I think sexual identity, LGBTQI, folks are feeling more free to come out and express who they are. And that comes with its own set of pressures. So that's also part of it. We're also seeing higher mental health and substance use issues in our teens who are in rural areas, more so than urban, which isn't really different from our adults. But we're seeing stress, depression, really just the different pressures of the socioeconomic environment really affect kids. And I honestly do think that being shut down and locked down for 2 years as in very developmental ages. For those like Sammy and Adelina today as seniors, during the pandemic, they were at a very developmental, formative time in their life. So being shut down and isolated for 18, 24 months has an impact. And that's going to affect how we're able to deal with stresses and pressures now. So the factors are many, and it's just different. It's different than it was for you, Crockett, and it was for me.
Girls, I'm going to come back and pivot to you here a little bit and say you've already done so much. This is amazing. I don't think it can be. I think I speak for Amie and myself when I say you two are amazing. The group that you started this with should be super proud of yourselves. Unfortunately, we know that this club kind of started with there have been a few incidents at your school that have really kind of brought this group to life. And so I want to send lots of love to Souderton High School right now and that whole community there. You've already done a lot. Where would you like to see this thing go? You mentioned North Penn you've already had conversations with other high schools. I'm sure when you started this thing, maybe it was just to be the group that was kind of like, hey, we're here for our high school. But now, I mean, you are riding a wave right now that could really take this someplace special. So as two high school students in the mix of it right now, seeing this club take off into something even more than that, where would you like to see it go from here? What kind of are your goals with it as it continues to grow?
Yeah, so we actually had a meeting this morning talking more about where we want it to go. So right now we're kind of focusing on like more of a structure of how we formed the club, because a lot of this has just been like awareness and just getting the name out there. And now that we've done that and clearly well, we're really trying to like hone in on what we would do and how we'd really get our message across to the students. So we've had a few ideas, and one of them is we really want to do like like mental health walks around the school, and kind of just talk about some strategies to manage stress and anxiety, as well as tell other people about the programs we have here at Souderton, because we do have really good programs. It's just a lot of people aren't aware of them.
Yeah, and also once we do those walks, I feel like connecting with the community, we want to give our people who are in the club events that we're going to go to connect more with the community, to connect the school to the community and not have it separated.
Amazing.
Seriously amazing. Amie, I'm going to come to you because one of the things that we've harped on in this podcast a little bit has been the next level. Listen, these girls have been in front of congressmen and women, right? They've been in front of state representatives.
Impressive.
I'm sure that's got to make you smile a little bit there, Amie, as well. Because that's one of the things that we've talked about, the next level, the people that can take this and really give this that extra momentum. So where would you like to see, Amie, this kind of thing continue to grow with the effort that these girls in this school have made?
Yeah, well, first of all, going and standing in front of our state senators and representatives and looking them in the eye and what you girls did and saying, what are you going to do about it? I mean, brave and forward thinking and kudos, because we can do that at the healthcare level every day, all day. And while that's very important and we're going to continue to do that, it's going to take, folks in that 16 to 24-year-old demographic range to go there and stand at their door and say, where's the funding for this? Because we are not going to be able to sustain mental health care at the level we need it without the proper funding, without parity for mental health and physical health payers and insurance. And we are preaching it all the time. So where I want to see this go is to have mental health care funded at the same level as physical health care. And the only way we're going to see that happen is by these lovely young women and men going and looking our legislators in the eye and saying, what's your plan? Because we have to do it together. And so this is how it's going to get done. I think there's some great mental health clubs in lots of schools. VITAM is one. And there's some local funding for that. And I applaud our counties for supporting that. But I think if we're going to reduce, right now, I think it's about 1 in 4 high school students seriously thought about attempting suicide in 2023, 1 in 4. So if we're going to really make a dent in those numbers, We've got to have groups like this that are nationwide and that are sitting on the doorsteps of their state capitals and demanding equal coverage, insurance coverage for all mental health and medical issues, diseases, treatment.
I think the last kind of question that I want to come to here, Amie, I'm coming right back to you on this one, is for students who are listening, for parents who are listening, for friends who are listening. Clubs like this are amazing. And again, if it just starts with a text message that says, "Are you okay?" That is an incredible, incredible start. Amie, for you, with the seriousness of what mental health can be, especially at this age, at what point, as a friend or a family member, do you step in and say, "Hey, I think we need to go and talk to somebody. You need to go and talk to somebody about what's going on here." And the best way, these clubs are amazing. Again, I'm going to keep using that word, amazing. You two should be really proud of yourselves. But for the perspective of not everybody's so comfortable going and talking to their friends, or I'm fine, I'm good, everything's good, don't worry about me. For the people that see it, for the parents, for the siblings, for the significant others, for these kids who see something that says, "I really think you need to talk to somebody," the best places for them to start beyond friendships and clubs like Are You Okay, that are kind of the next level of, we need to have a mental health conversation here?
Yeah, I think, first of all, the adults in the school systems, kids can go to the trusted adults, whether it be guidance counselors, school administrators, teachers, tell the adult, right? Talk to the trusted adult. And as trusted adults, we want to really take a look at emotional changes, behavioral changes, physical symptoms that are troublesome. Are kids missing school? Are they coming in late? Are they leaving early? Are they skipping classes? What's going on? And we need to take those things seriously and say, let's have a conversation with your parents and or parents. Let's have a conversation with your pediatrician or your primary care doctor, and let's really talk about making sure there's nothing wrong physically. I mean, we all know that adolescence is hormonal, and there's a lot of just social pressure, which is normal, right? It's a rite of passage, and we all have to go through it. But if we see that there's some sort of interruption in that normal developmental process in terms of significant depression, impaired sleep, thoughts of suicide, all of that needs to be immediately addressed and taken seriously. And if somebody says, "I'm not okay," get them help. There's 988, which is the national hotline for mental health. There's 911. There's local walk-in emergency centers. There's hospital emergency centers. There's family physicians. There's therapy, right? Talk to a trusted adult, and we need to listen when people say they're not okay, or we need to call them out when we see signs that they're not okay.
Oh, I didn't mean for the last question to be so heavy, but I think this is an important conversation. This is a mental health conversation. And Adelina, Sammy, I have to say to you, I think this started with just caring about your friends, caring about people around you. I think in a very divisive, kind of crazy world that we're living in right now, caring about one another can go a long way. To the two of you, the word that Amie used earlier was kudos. I will double down on that and say kudos. The work you're doing is amazing. Please continue to do great things. If you ever have any of those events, you let us know. We'll help spread the word. Try to keep the good news going out there. And so thank you both for joining us today. We really appreciate it.
Thank you so much for having us.
It is Are You Okay? Where can people, do you guys have anything from a social standpoint? Is it Souderton High School? Where do you have anything that you can help spread the word with?
Yeah, so we do have an Instagram. It's the letters RUO and then K_Souderton, or just Souderton Are You Okay? So we'll definitely keep posting up there about kind of just messages, not always just like club meetings, but we're hoping to use our social media platform of like spreading more awareness and like ways to manage the stress and like just like things about depression, and just letting people who follow able to read just quickly on their daily scroll through Instagram.
Love it. I love you using social media to spread the positive message and know that support is there. And, you girls always have a support in us, If you need anything, if anybody needs anything, you know that St. Luke's is here for you guys.
You guys are rock stars. Like, that's really cool. I gotta be honest with you.
Thank
It's
you.
really
you.
cool what the two of you are doing. So thank you so much for letting us know. It's Are You Okay? If you're listening and you're a high school student, you're a parent, you're a guidance counselor, you're a teacher, you're anybody who cares about people, this seems like a good place to start about caring about one another. Go ahead and check them out. Are You Okay? For Adelina Catrona, for Sammy Stankus, for Amie Allanson-Dundon, I appreciate you as always, my friend. Feels like a good spot, a good warm hug to wrap up this thing called the Just Start the Conversation podcast today. It's brought to you by St. Luke's Penn Foundation. You can visit them at pennfoundation.org. My name is Crockett. Once again, want to thank you all for tuning in to the Just Start the Conversation podcast.